Welcome to iPEMS, a podcast series that teaches about pediatric emergency medication safety and equips providers with strategies for quality improvement. I am your host, Dr. Tiffani Johnson of the Emergency Medical Services for Children National Resource Center. In this podcast, we will review some of the human factors that impact patient safety with a focus on children in the emergency setting. In 1999, the Institute of Medicine released a landmark report titled "To Err is Human." This report brought increased attention to patient safety issues and made recommendations for improvement. I find the title of the report to be very fitting. As medical providers, we sometimes forget that we are in fact human, and every single human is bound to make mistakes. The term human factors, also known as ergonomics, refers to how humans interact with the complex systems in which they work. This includes the tools they use, the people they work with, and their work environment. The science of human factors has been used in the aviation and nuclear power industries for many years to improve performance and safety. Recently, we have seen these principles applied to the medical field to make it easier for healthcare workers to do our jobs better. Let's do an exercise to demonstrate how the human mind can play tricks on you and how easy it is to make a silly mistake. If you are listening in your car, take a look at the accompanying slides later. Read this sentence and tell me how many F's you see. How many F's did you count? Most people count 3 at first glance, but there are actually 6. Many of us overlook the word "of," which appears 3 times in this sentence. In the emergency medical setting, we can sometimes overlook minor details like this, which can result in a medication error or a near miss. Now let's look at the chart on the screen and say the color of the word, not the word itself. It's hard, isn't it? That's because the right half of your brain is trying to say the color, while the left half of your brain is trying to say the word. Even if you approach this task with a great deal of focus and determination to get every color right, you may have still made a mistake. The same can happen when you are at work. Understanding human factors is important for physicians who work in a high-stress environment, such as the emergency department. While a certain amount of stress can be positive and get your adrenaline pumping, high stress levels lead to poor performance. Let's discuss some factors that make the ED a high-risk environment for medication errors. First, the emergency department can be very hectic. Taking care of a large volume of very sick children in a time-constrained environment increases your chances of making a mistake. When caring for children, the pressure is multiplied. Not only are we caring for the patient, but the needs and concerns of parents and caregivers are also a contributing factor to high stress levels. When considering medication safety for children, there are multiple steps to ensure the correct dosage is calculated, prescribed, and administered. We will explore some of these pediatric-specific dosing challenges in a separate podcast. We often encounter frequent workflow interruptions in the emergency department. For example, providers such as nurses or consultants may ask questions while you are in the middle of writing an order. A distraction such as this can lead to a mistake. The shift work in the emergency setting leads to multiple patient handoffs where information may be missed or miscommunicated, leading to errors. Night shifts can also lead to fatigue that affects performance. Physicians in training experience additional factors that make the ED a stressful environment and one that is high risk for medication errors. For example, balancing the ED flow and clinical responsibilities with learning can be a very difficult and stressful task, to say the least. Also, due to limited evidence-based guidelines in the field of pediatrics, trainees often work with supervising physicians who have great variability in how they practice medicine, creating another confounding factor. In the ED, there may be trainees at different levels, including medical students, residents, and fellows, with varying amounts of supervision being provided. Inadequate supervision may increase the chances of medication errors. Also, trainees may have to rotate to outside hospitals and learn how to function in a system that is unfamiliar while working with team members who they've never met. Lack of predictability and familiarity are factors that can lead to human error. Sometimes when caring for sick children, we forget how important it is to take care of ourselves. This includes simple things like eating, getting enough rest, exercising, and spending time with loved ones. When we don't take care of ourselves, we have higher levels of stress and fatigue that can increase our chances of making mistakes. As trainees, it is very important to recognize signs of fatigue. In fact, it is so important that the ACGME has made it a requirement. Some of these signs can include yawning repeatedly, falling asleep in conferences, feeling restless and irritable, having difficulty focusing on the care of your patients, and feeling like you just don't care. We all experience these symptoms at some point in our training. It's important to recognize these signs and how they can impact patient care and our personal health. Try to get adequate sleep daily and take naps before night shifts. The science of human factors recognizes that mistakes are inevitable, particularly in complex environments like the emergency setting. This knowledge is used to design systems that can reduce the risk of errors. The World Health Organization makes the following recommendations for applying human factor science to working in the medical setting. The first strategy is to avoid reliance on memory. Follow protocols when available, and when in doubt, look it up. Make good use of your resources. Second, simplify common processes and procedures. For example, emergency departments should simplify processes for patient handoffs, prescribing, and discharge. Third, standardize these processes throughout the hospital. Having different systems in every department of the hospital can be challenging for trainees who rotate through several departments. Finally, use checklists when possible. An example of when a checklist should be used is before performing procedures in the ED to make sure you have the right patient and the right site. Thank you for listening to this episode of iPEMS. I hope that after listening to this podcast, you have a better understanding of the human factors that can impact patient safety. Remember, despite how educated, reliable, motivated, and thorough we may be, we are human and we're going to make mistakes. Now that you understand how human factors impact patient safety, you can begin applying the safe practices discussed here, especially when prescribing medications for children and communicating to other members of the team. To learn more about medication errors in the pediatric emergency setting, please listen to other podcasts in the iPEMS series.
The iPEMS series is a production of the Emergency Medical Services for Children National Resource Center in partnership with the Alliance for Pediatric Emergency Medication Safety.